What's going on, guys? Tony Maritato, physical therapist here, and I want to talk to you today about one of my favorite ways for patients to work on improving terminal knee extension, getting the knee straight when they're lacking 5 degrees more or less of knee extension. So let's say you can't get the back of your knee to touch the bench when you're at physical therapy, or you're just not quite getting full extension there. It's one of those things that we want repeated exposures. Stretching it once or twice in a day is just not going to be enough to stimulate the tissue response to increase the length of the connective tissue. We want repeated exposures, something we can do just all the time, constantly, every hour. One of my favorites is in the kitchen. So if I'm in the kitchen, I'm prepping a meal, I'm doing something, washing my hands, whatever. If we're going to pretend in this case it's my left knee that had the knee replacement and is lacking extension. There are a couple ways I can do it. So what I do is I have my left foot forward, I cross my right foot in front of my left, and if I can bring my right toe back just a little bit relative to my left toe, what happens is as I press my right knee back, it's pressing into my left knee. So I get a little bit of overpressure is what we call it in therapy, helping to improve the knee extension. But what's even nice about this is now I can lean forward on the countertop while I do it. So I've got a stable surface to hold on because this is a little bit unbalanced. I can press into the left knee to improve the extension, hold it for 5 to 10 seconds, and then I can relax. I can allow both knees to bend just a little bit, take the pressure off, and then increase the pressure again for the second rep. I can come down onto my forearms, my elbows. So again, I'm real stable in this position. It just makes it a lot more comfortable, and this is something that I can do for 5 to 10 seconds, 10 repetitions. Then I can unwrap it, I can do whatever I'm going to do in the kitchen, and then I can go back into it for a second set. If I'm talking to somebody, I can lean back against the counter. Again, I bring my non-surgical leg in front of my surgical leg. I press back into extension. I can feel the pull in the back of the left knee, the surgical knee. I can feel a little bit of pressure in the front. I'm in total control. This is something that you have control over. And I can sit here and I can converse and I can talk and I can, yell at my husband and tell him what to do and what he's doing wrong. Just kidding. But the idea is that these are the repeated exposures that we're looking for. And then if I grab a chair, and I'm sitting here, whenever I get a chance, I prop the surgical leg up, I bring the non-surgical leg on top, and even just the weight of the non-surgical leg resting on the surgical leg, I can do it both legs straight. I can come in here, let the non-surgical knee bend, and I'm above the kneecap. I'm more on the thigh of the surgical side. But this is giving me that little bit of overpressure. I've got tight hips, me personally. The tightness in my hip, it's good. It's a good stretch for the tightness in my hip, but it's also creating more pressure on the surgical knee. So my main goal for you, and then last one that I always like, if this is uncomfortable, this is another option where I stack my feet. So my surgical leg is on top of my non-surgical leg. I can sit here playing on my phone, I can read a book, I can watch TV, I can do whatever. But just there's a sense of traction. My non-surgical leg is extended. My surgical leg is being pulled into extended. Typically, the traction force produces knee extension and is less threatening to the nervous system as the compression force, right? When I'm sitting like this and it's pushing down, my response is I want to tense, I want to tighten, I want to get away from that sensation. But if I go here and my right foot is extending my left knee, it's less threatening. And if it's less threatening, my muscles can relax, I can be a little more at ease. If I had my rolling pin, I could do my rolling pin from this position. So the idea is you want to find multiple opportunities throughout the day to expose the knee to the positions you want. If flexion is more of your problem, then when I'm sitting here at the sink, I've got a little stool, I've got a little chair. Even if you're sensitive on the incision, you don't want to apply pressure, my knee isn't touching the bench. the stool, my shin is, my ankle is. But I'm getting work into that position. If I'm not going to use, maybe you don't have a stool because you don't live in a clinic, a chair. A chair just like this. Again, the knee doesn't have to apply the pressure. The pressure is at the shin and the ankle. But the idea is while I'm here, while I'm doing stuff, I could be working. I can swing this around depending on how tall you are and how much range of motion you have. And I can be in this position. It's the opportunity to find those repeated exposures to put the knee in the position where it's near the end range of motion, not to the point of pain, but certainly to the point of feeling the stretch, feeling slight discomfort, but being well within the range that you can tolerate. Because it's one of these things that we want long duration, low intensity, repeated bouts of exposure. If I could expose the knee to this position multiple times an hour, multiple hours a day, I am absolutely going to increase the range of motion. But what the trap is the person who puts all of their effort in, 40 minutes, super hard workout, and then they're wiped out and they can't do anything for the next 12 to 24 hours. That is not an effective strategy. It's slow and controlled, repeated exposure, multiple episodes. Guys, as always, thank you so much for watching. Thanks for liking the channel, liking the video, subscribing. I'll catch you guys on the next video.